October is Breast Cancer Awareness Month, and today we are focusing on raising awareness and educating everyone on the risks of breast cancer. Everyone is prone to breast cancer, but the risk is most to women. Men can too have breast cancer. We have a special guest today, Martha, and she's going to walk us into her life. She's a cancer conqueror. Welcome, Martha. Can you please introduce yourself to the people, to all our viewers?
Thank you so much, Catherine. My name is Martha Machagomora, and I'm a breast cancer survivor.
It's not easy to come and open to talk to people about surviving breast cancer, Martha. So thank you very much. Can you tell us from diagnosis up to acceptance?
I smile because acceptance it's not easy. Okay, from diagnosis, I was first diagnosed with breast cancer in 2021. That's around March. It was a tricky situation for me because initially my doctors couldn't locate where the cancer was coming from. So I had to go through a couple of tests. I went through the mammograms, the scans, the x-rays, and all those were coming out negative. Then I had to go for biopsy. Biopsy came out positive, but there was a challenge there. They couldn't it couldn't tell us where the cancer is. So it was a bit tricky situation because the surgeon didn't know whether to have surgery or to have both lumpectomy and mastectomy. So they had to make a quick decision there. And at that point, that's when things became tough for me because you're trying to think, okay, fine, they tell me they've got cancer, but now this is delaying. You need to go for surgery. You need to get this thing out of the way.
How did you get to know that you had breast cancer? Did you do the self-examination?
No, no, no. With me, I started with a lump just in my armpit. There was a lump that was painless, so I just ignored it. Then, with time, I had some pain under my left breast. That became worrisome and led me to going to see the doctors. That's when I went through all those tests I was talking about.
Martha, you say the lump was in your armpit
Yes,
and it ended up as a breast cancer diagnosis.
yes.
So you mean to tell me that the breast cancer can start from any part of the body, not necessarily breast, because we just examine our breasts. We never know that
Yeah,
any lump anyway
yeah,
could be
yeah, yeah,
suspect.
yeah, yeah. Yeah. With me, that's why I said it was a bit tricky, because the lump was, I was in my armpit,
Mm.
and there was no lump in my breast.
And it was painless? No
Yes,
pain?
no pain.
Mm. How did you receive the diagnosis? Because you say it was like a journey. You went for the first test, then the doctor wasn't even certain. You went for the mammogram, that's when they picked it. Can you
They picked it
please?
at biopsy.
At biopsy.
Yes.
Can you tell us what biopsy is? Because we usually hear, I've gone for a biopsy. Can you please explain what a biopsy entails?
Okay, a biopsy is when they take a chunk from you,
Mm-hmm.
the area where you're saying there's a lump. They take the chunk there,
Mm-hmm.
and they take it to the labs for further tests. So in Zim, because I went to Lancet, they said yeah, they have to post it to South Africa. So they posted it to South Africa. We had to wait for results. That's when they came out positive.
Do you have medical insurance?
Yeah, I was using medical insurance because cancer really it's one disease that's very expensive. You go through a lot of costs, but at a certain point, my medical aid couldn't cover.
You had
Yeah,
shortfalls.
yeah, it's shortfalls. You definitely have shortfalls.
And how did you manage that? Because were you paying in the local currency or in the greenback for the services?
Yeah, for the services, the doctors require the USD. Yes,
And it's quite
it's quite lump sum.
expensive, cumbersome.
It's quite expensive. I
And
can give you an example of one injection that I used to get once every 3 weeks. That one costed about 650 USD,
650.
and I had to have the 650 by 17 doses.
Still on talking on financing the health, what do you suggest should be done?
Now my cry is at least we have some funding towards cancer, because if you look at it in our country, lots of people are losing lives because of lack of funding. They don't have money to pay for the drugs. They don't have money to go for the various scans, for the blood tests. You're supposed to get blood tests, scans, X-rays. It's quite a lot. So at least if we have some tax towards cancer, it will be quite helpful.
To those who are just receiving their diagnosis, what do you say to them?
No, the solution to cancer is, I think, early detection. We need not to be fearful. We need to get regular checks, go for our regular checks, because with early detection, at least cancer is said to be curable.
Tell us about the family support and all those people who supported you. They can be friends. I can see your friend today. So, talk of the importance of support to someone who is fighting cancer.
Yeah, support is quite critical with someone fighting cancer. You really need all the support you can get from family, from friends, from spouses, from church members. I was fortunate that my husband was quite supportive. Also, I had my family, they were quite supportive. It's not just support during cancer, it's support even after. When you're in remission, you still need that support.
You talk of support being therapeutic,
Yes.
and can you please walk us on the treatment that you went through? I understand chemotherapy is ravishing on an already ill person, and mentally, again, I understand the mental aspect, the mental health is also very important. Can you please tell us how you processed it, how you managed your treatment, and what it was on your mental health?
We say cancer is really a journey, because you are in and out of surgeries. You're always seeing the doctors. You go through a lot. So you really need that support we're talking about. Because with me, it had to be surgery first. Then I went on to chemo, 8 sessions of chemo, which were chemo always be chemo. This is not easy. You're losing your being, you're losing yourself. It's Your life just changes all of a sudden. You're talking about the side effects of chemo.
Chemo.
Yes, losing your hair. That was the worst part. Appetite. Your skin changes, skin color changes, your nails, everything changes.
Have you continued with any other treatment, or it was chemo and you were okay?
No, I was a stage 3 breast cancer. I had to go through radiotherapy,
All
a
right.
month of radiotherapy, and a month of you'll be going every day, excluding weekends,
Weekends.
Saturday and Sunday, Monday to Friday, every day for radiotherapy. After radiotherapy, I also got I'm on tablets.
For radiotherapy, in our local languages, people say kupiswa. What's the effect of kupiswa, of the radiotherapy on you? Because that word is scary, yet it's a necessary part of recovering.
Yeah, it's quite necessary, because with radiotherapy, you've gone through chemo, right? So after that, you're going through radiotherapy. Radiotherapy is meant to burn if there are any cancer cells left.
Okay.
That's what it does. It burns up the leftover
Cells from the
from the
chemotherapy. So it was
chemotherapy.
surgery, chemotherapy, then
Radiotherapy.
radiotherapy.
Yes.
And you've continued to take on some tablets.
Yeah, I'm on tablets.
Are these tablets going to be like a lifetime journey, or
No, for
you
the
are
next
on
5 years.
for the next 5 years? And the cost, your medical insurance is
Yeah,
covering
yeah,
that.
it's covering it.
All right. I understand that one has to have a special diet when they are on cancer treatment or something. Is that true? Or
Yes. I mentioned earlier on that your life changes.
mhm,
You're told stop taking this, stop taking that, stop taking things like beef,
mhm,
sugars. That's a drastic change. All of a sudden, you're told stop. So that's got an effect on you
on
naturally.
you,
Yes.
and stopping all those basics, maybe carbohydrates, um,
Yeah. You're told take
a small
things like
portion.
a small portion, brown rice, the browns like Gio
Mhm.
and stuff.
And it's expensive.
Yeah,
The
that's
switchover is quite
it's quite
expensive.
expensive.
Mhm.
The diet is quite expensive.
So, as a cancer survivor, you are calling out for the government, for the corporate world, for everyone to come up with a fund. If it was done in the year 2000, when we had the AIDS levy, we are one of the countries with the domestic funding for the AIDS levy. What is your plea on the cancer levy? It's doable. We have the AIDS levy.
Yes, as cancer patients, we crying out to the government that at least consider this cancer levy. Because if you look at cancer right now, it's on the rise. I'm not sure of the statistics, but I believe it's on the rise.
Yes, I read an article recently where it said more Zimbabweans globally are dying of cancer. It's so sad. We don't have to be talking of people dying.
True.
We should have early detection, early screening, and women should be going for free screening.
True.
October is a month that we amplify breast cancer. It's getting the message with a bang. We keep banging it. But it should be an everyday thing.
True.
What do you
True.
say about cancer every day, 365?
Yeah, that's the challenge in Zim. We doing it in October only. It's supposed to be a daily thing. One goes to the hospital, they're able to get free screening and not just amplify it in October. So our plea is that at least let's just consider it like a daily thing.
It should be a norm to have
Yes,
breast cancer screening.
just like a BP patient, I can go to the hospital get my
Hmm.
BP checked.
Hmm.
So one should also be able to go to the hospital and get screened for cancer.
Now you live in the capital city in Harare. The services are available, but at a cost. What can be done for the woman who is in Mtawa Tower, diagnosed of breast cancer?
True, it's quite challenging because if you talk about radiotherapy, you're looking at two machines in Zimbabwe,
Mm.
two public machines, one in Blueo and one here in Pare. And most of the time, these machines are down. You see, so you can imagine. I was talking about you have to get your radiotherapy every day, and one comes from Tower. They are living with a relative, and they have to go for radiotherapy like daily. You're going to talk about the transport, you talk about the food. He or she is staying with a relative. So I think if we can have more machines, it will be quite appealing.
I can say you have scaled the mountain. You are a survivor, but you continue fighting every day. What is your message to those who are fighting cancer, to those who are on a mission, to those who have not been screened for the past 2 years or so? What is your message?
Uh, my advice to everyone is cancer is not a death warrant. It doesn't mean you're gonna die if you're told you've got cancer. So I encourage people to get screened. To that one person who's at home and they're fearful, because I've heard of stories people saying if you go you're gonna go for chemo, they need to kill you. That's not true. But the more you delay is the more you're getting closer to your own death. So it's time we take our own our health is our own responsibility. Go for these checks, get out the checks, and above all, our life is not ours, it belongs to God the Creator. I believed in God, and today I'm here. he plays a critical role in our lives.
We usually hear people saying if you're over 40, you need to go for breast cancer screening. What is your message to everyone, even those who are not yet 40? Because you are
Yeah,
youthful, you are a young mother. What is your message?
yeah, 40 they say you're supposed to go, but now in this environment, considering the foods that we're eating, they're also contributing. So you really need to go, whether you're 30, 20, just go for screening and be sure about your health.
Thank you, mother. Do you have any other words that you'd like to leave, like the take home message for those viewers and listeners?
I'll I'll continue to encourage everyone to go for screening, especially this month. I think we've got a couple of organizations that are offering free screening. Let's go for screening and get checked and be sure of our health. There's nothing fearful about cancer. Here I am. I'm healthy. I'm actually advancing in my studies. So
Wow.
the sky is the limit. It doesn't mean if you're told you've got cancer, then you're dying tomorrow. It doesn't mean that. You can make it 20, 30 years. Someone can die of an accident, but you can survive. So let's go for screening. Thank you so much.
Thank you, mother. As Martha said, you don't have to be 40 to go for screening. You're 20, you're 30, you're 60, 70. Every woman should be screened for breast cancer. Even men get breast cancer too. So be screened. There is life after that diagnosis. Martha is here and she's in her journey. Thank you, viewers.